Welcome to The Deep Dive, your weekly shortcut for what's happening in digital health, automedicine, and biotech right here on White Coat Hackers Media. Today, we're really tracking innovation, starting right on our bodies with some new devices, then zooming out to see how AI is tackling diagnoses, and even changing how patients and systems interact. We've gone through the latest developments to pull out, the key insights so you get the picture of what's really moving the needle. Okay, let's unpack this, maybe start with something many of us see every day, wearables. Samsung just had their Galaxy Unpacked event, right? And the new Galaxy Watch8 Series seems to be pushing past just steps and calories. Sounds like some serious health monitoring is built in now. What are the features that really kind of jump out?
Yeah, definitely. What's compelling about the Watch 8 is, well, how it's becoming much more of a health tool. A big one is its ability now to spot signs of moderate to severe sleep apnea. That could be a huge deal for, getting people help sooner. And they've also added vascular stress monitoring. It looks at something called vascular load to gauge stress on your circulatory system. But maybe the most novel thing, it's the first smartwatch with an antioxidant index. It actually measures carotenoid levels.
Okay, hold on. An antioxidant index measuring carotenoids on your wrist. That sounds, incredibly specific. What does that actually tell someone?
It's pretty insightful, actually. Carotenoid levels are like a direct biomarker, showing your body's antioxidant status and, your overall nutritional health. Basically gives you a clue whether your diet is providing enough antioxidants to fight off oxidative stress and inflammation, or, if maybe your habits are leading to more cellular stress.
Interesting. So it's like a little window into your diet's effectiveness.
Kind of, yeah. And beyond that, the Watch 8 also builds on its sleep features. There's bedtime guidance now, using your circadian rhythm and how long it takes you to fall asleep, to suggest the best times for you to sleep and wake up, plus the usual wellness stuff. Running coach, the together feature to compete with friends, high stress alerts, mindfulness tracking, an energy score. It's pretty comprehensive.
Wow.
And it's all boosted by a deeper partnership with Google. It's the first watch preloaded with Wear OS 6 and Google's AI, Gemini. Gemini can even kickstart the Samsung Health app for workouts.
It's just fascinating how this continuous, non-invasive monitoring is becoming so accessible right on our wrists. What do you think this constant stream of data, especially with things like an antioxidant index, means for that shift towards proactive health?
I think it means we're really moving towards a time where these everyday devices give us a much clearer ongoing picture of our health, often before we even feel symptoms. That whole idea of shifting from reacting to illness towards proactively managing wellness, it becomes way more achievable when you have this data.
Yeah, makes sense. Okay, building on that idea of continuous insights, let's talk about blood pressure, a huge one for millions. Aktiia just got FDA clearance for their G0 blood pressure monitoring system, the Hilo Band, I think it's also called. What's the big leap here?
The really revolutionary part, it's completely cuffless.
No cuff?
Nope. It's an over-the-counter wearable, sits on your wrist. It uses an optical sensor to gather data right there. That data goes to the Hilo app and their cloud server. Then, algorithms estimate your blood pressure using something called pulse wave analysis. Essentially, it's analyzing the shape of the pressure wave from each heartbeat as it passes through your wrist vessels.
Okay, so it's reading the pulse wave.
Exactly. And it's designed to collect data continuously through the day, but, and this is important, only when the user is still.
Oh, okay.
It's already got CE marking in Europe as a Class DA medical device, and getting that FDA 510K clearance here in the US is significant. It means the FDA agrees it's safe and effective, basically comparable to existing devices. People in the U.S. should be able to get it sometime in 2026.
So that continuous cuffless monitoring, it sounds incredibly convenient, like way easier than pulling out a cuff multiple times a day. But what about that limitation the user has to be still? Does that kind of reduce its usefulness for truly continuous tracking during a busy day?
That's a really good point. The stillness requirement means it's capturing measurements during moments of rest, like when you're sitting, reading, maybe sleeping. Yeah. It's not going to give you a reading while you're, say, jogging or actively moving around.
Right.
So its strength is more in passive baseline monitoring throughout the day and night, not real-time exhaustion tracking. But even so, for many people, getting that much passive data can reveal patterns you'd absolutely miss with just occasional cuff readings.
I see. So it's about building a different kind of picture.
Exactly. The challenge, I think, will be educating patients on what these continuous but passive readings really mean and how to interpret them.
Okay, that makes sense. Let's shift gears a bit now, away from personal wearables and towards diagnostics, a really critical area, cancer. Artera, a company working on AI cancer tests, got FDA breakthrough device designation for its Artera AI prostate test. Can you break down what this AI actually does, and why is that breakthrough status important?
Absolutely. That breakthrough device designation is a big deal. The FDA gives it to technologies that could offer more effective treatment or diagnosis for serious, like life-threatening conditions. It helps speed up development and review. So this Artera AI prostate tool, it's designed to help doctors make really specific risk-based decisions for men with localized prostate cancer. Its core job is to analyze digital images from a patient's prostate biopsy slide.
Okay, so it looks at the actual biopsy tissue, but digitally.
Precisely. An AI algorithm evaluates those images, and then it combines that analysis with the patient's clinical data, things like PSA levels, Gleason score. Based on all that, it predicts long-term outcomes, specifically the 10-year risk of the cancer spreading, so distant metastasis, and also the risk of dying from prostate cancer.
Well,
And the whole point is to help the clinician figure out the best treatment path for that specific patient. Is aggressive treatment needed? Or is active surveillance maybe safer? They've also just launched a big registry study, Direct AI, to see how the test actually changes treatment decisions in the real world and track patient outcomes over years.
that's incredibly powerful. Giving doctors and patients much more personalized information for these really tough decisions. How does a tool like this, predicting way out into the future, fit in with the doctor's own clinical judgment and experience? Is it a replacement or?
Oh, definitely not a replacement. It's augmentation. Think of it as another really sophisticated data point. The AI gives this objective, quantitative risk score based on analyzing patterns maybe even invisible to the human eye. It complements the clinician's expertise. It allows for, more informed conversations with the patient about the risks and benefits of different approaches, pushing us closer to real personalized medicine.
Right, making that decision more evidence-based for the individual. Got it.
Okay, for our last area today, let's look at how AI is tackling a huge challenge in healthcare, the workforce shortage. But this time through direct patient interaction. Hippocratic AI is working with KPMG on this, and it sounds pretty radical, AI agents actually talking to patients.
It is fascinating, yeah.
Yeah.
The collaboration with KPMG is about helping health systems and even governments deploy these patient-facing AI agents from Hippocratic AI. The goal is to help ease the strain on the healthcare workforce internationally and just improve access to care dramatically. Hippocratic AI itself, they only started in March 2023, and their whole focus is creating these healthcare AI agents that interact with patients clinically. But, and this is crucial, they are very clear that these agents do not diagnose conditions or prescribe medicine.
Okay, so what do?
They automate certain patient interactions, things that are more routine, less complex. It's distinct from AI that works on back-end stuff like billing. They've grown incredibly fast since launching, raised a lot of money from big VCs, health systems, even NVIDIA chipped in. Wow, NVIDIA too.
Yeah. They've apparently customized agents for almost 100 different use cases already and handled something like 2.5 million automated patient calls.
2.5 million. Okay, so why does this specific application matter so much right now?
Well, the key insight is that generative AI makes the cost of certain interventions incredibly low. We're talking about low acuity, high volume interventions. Think appointment reminders, checking if someone took their meds, answering basic pre-op questions, stuff that takes up a lot of human time but doesn't require deep clinical judgment.
Right, the repetitive tasks.
Exactly. And this is really effective for value-based care models, Medicare Advantage, single-payer systems where managing populations efficiently is key. The proponents say AI has unlimited time and empathy, or at least consistent patience for these interactions. It costs way less than human call centers. And it directly addresses that worsening provider shortage crisis we keep hearing about.
That really does sort of redefine how we might think about patient access and efficiency. It's framing it as augmenting human care, especially when staff are stretched thin. But, with AI agents doing so much patient interaction, what are the practical hurdles? How do you smoothly integrate this into how hospitals already work and make sure it actually helps patients, not frustrate them?
Yeah, those are the key questions. Integration is huge. These systems need to talk seamlessly with existing electronic health records, scheduling software, so information flows correctly. Another piece is managing patient expectations, making it super clear what the AI is there for. It's an assistant for specific tasks. It's not your doctor. Building trust is vital.
Right, avoiding confusion.
Exactly. The ideal scenario is that this AI takes the repetitive administrative load off the human staff. That frees up nurses, doctors, other clinicians to focus on the complex cases, the conversations that really need human expertise and, frankly, human empathy.
What an incredible range we've covered today, really diving deep into digital health, biomed, and biotech innovations. We started with personal wearables like the Samsung Galaxy Watch 8, giving us these new windows into sleep apnea risk and antioxidant levels. Then Aktiia's Cuffless Blood Pressure Monitor, bringing that continuous vital sign tracking closer. Moved to advanced diagnostics with Artera AI Prostate, using AI to help personalize cancer care. And finally, Hippocratic AI, using patient-facing AI to tackle workforce issues and boost access. Quite a spectrum.
It really is. And if you sort of connect the dots, you see these aren't just isolated cool gadgets or software updates. They feel like essential pieces fitting into this much larger puzzle. It's all building pretty rapidly towards a future where healthcare is much more proactive, much more personalized, hopefully more preventative. It really makes you wonder, doesn't it? How will your own relationship with your health change as these kinds of technologies become just, well, part of everyday life?